My personal grandmother, she battled cancer. We weren't able to have her at my house or at home, so we had to give her or place her in hospice. And she pretty much passed away in the hospice, but we noticed that she was giving bad service. So we just pretty much teamed up with the director and let them know that we want to personally pick a good person for our grandmother to pass away with, so she didn't feel like too much alone. What if it was your grandmother, your grandparent? You always want to treat your grandparent with respect and love.
One of my patients had a seizure, and it was already 10 minutes over a seizure, and I was calling the registered nurse to come in and check her out, or would have called the ambulance. She called in and asked what was wrong, and I told her that one of the patients has been having a seizure, and she's like, well, I can't do nothing about it. We don't have medication for that. You should have just sent her to the hospital. You don't need to call me for that. That's so irresponsible. You're the registered nurse. You should know what you're supposed to do. Like, how can we help with those kind of patients? Be more compassionate towards patients. She should do that, because you never know if life puts you in a situation.
When I had my miscarriage, I had my caregiver. My daughter was with me, and she was actually helping me even feed my daughter. And to me, there was no need for her to do that, but she went all the way to help me and make me feel like I had her support. And to me, that meant a lot.
My grandma was at the hospital a couple months ago for pain on her shoulder, and the nurses were actually very, very nice and helped her with everything. They made sure to give her warm blankets because she was shaking, because it was very, very cold, and just the pain wasn't bearable, and it was just really bad. So they made sure to give her everything she needed. Like, working towards becoming a medical assistant, it made me feel like this is what I wanted to do. Like, this is what really wanted. Like, I wanted to help patients, and I wanted to do the same thing that they were doing, but be more kind of, making sure to ask them every time I passed by if they're really doing okay, if they needed help, or anything like that. I want to be able to have good communication with patients and connect with them very well.